insurance coverage and out-of-pocket cost trends in 2025. Cost and coverage remain the single largest barrier to widespread access. Commercial coverage for obesity. Only an estimated 27% of commercial health plans currently cover GLP-1 agonists specifically for chronic weight management, obesity, PBM report, 2025. This number increases significantly if the patient also has an underlying diagnosis of type 2 diabetes. Out-of-pocket costs. For patients without coverage, the average monthly list price for both semaglutide and tirzepatide remains high, typically exceeding $1,000 to $1,300 per month without manufacturer coupons, KFF, 2025. Oral formulations. The anticipated increased adoption of oral semaglutide for T2D and future oral obesity medications is expected to marginally decrease out-of-pocket costs for some segments, but injectable forms still dominate efficacy statistics. Patient-reported satisfaction and side effect statistics. Real-world experience, often shared on platforms like Reddit and health forums, complements clinical data by highlighting patient compliance and tolerance. Patient satisfaction. Across major forums, Reddit r, semaglutide, real self, patient satisfaction ratings for overall efficacy and life improvement stand consistently above 85%. Reddit, real self analysis, 2025. Common side effects. The vast majority of reported side effects are gastrointestinal, GI. Nausea, reported by 68% of patients starting semaglutide, decreasing significantly after the first month, Clinical Studies Meta-Analysis, 2025. GI issues. Nausea, vomiting, and diarrhea are the primary reasons for discontinuation, though only representing a 5 to 8% total discontinuation rate, PubMed, Clinical Trials, 2025. Compliance. Compliance rates remain high relative to older weight loss medications, with approximately 78% of patients adhering to treatment protocols after 12 months, dropping to 65% after 18 months due to cost or side effects, Patient Registry Data, 2025. Learn more about the tirzepatide injection guide, future market predictions and key findings for 2026. Next generation compounds. Upcoming approvals, including potential GLP-1, amylin or triple agonist combinations, are predicted to raise the average TBL potential to 25 to 30% by 2026. FDA Pipeline Report, 2025. Oral formulations. The expansion of oral GLP-1 medications for weight loss will open up therapy to patients hesitant about injections, potentially increasing the total addressable market by 20%. Market Analyst Report, 2025. Key Findings Summary. Efficacy Leader. Tirzepatide, Zepbound, Mounjaro, leads with an average TBL of approximately equals 22.5% in clinical trials. Access Barrier. Over 70% of commercial plans do not yet cover GLP-1s for weight loss, making cost the primary obstacle. Patient Satisfaction. Over 85% of patients report high satisfaction, outweighing initial GI side effects. Read our GLP-1 safety information. Conclusion. What these trends mean for patients in the Southeast U.S. The data for 2025 is clear. GLP-1 agonists have fundamentally changed the approach to chronic weight management. For patients across the Southeast U.S., FL, AL, GA, NC, SC, VA, this statistical landscape means hope for higher efficacy. Tirzepatide offers clinically superior results, providing a viable option for patients who may not have achieved their goals with semaglutide or older therapies. Insurance advocacy is key. Given the low commercial coverage rates, successful access often requires detailed documentation and appeals. Working with a clinic experienced in securing approvals is critical. Prioritizing safety. While side effect profiles are manageable, primarily GI, clinical oversight is essential for dosage titration and managing rare, serious events. As we look toward 2026, the trend is one of increasing efficacy and expanding options. The future of medical weight loss is here, and it is overwhelmingly positive. Visit the link in the description below for more information.